Hello, hello. Welcome to Whitman-Walker Live with me on a Monday. I know. Normally we are on Thursdays, but today we are going live on Monday with a special guest. So come on in, come on in. Let's see. Come on in, everyone. Come on in. We're going to get started in just a few seconds. We have a special guest today. Hello, hello. Come on in. Welcome to Chats with Whitman-Walker. We have a special guest today. So come on in, come on in. Let's see. Hello, hello. How are you, Keith?
Hey, I'm good. How are you doing?
Doing good, thank you. Give me a second. Let me fix this now that you came on. There we go. Welcome, everyone. Come on in. We're going to wait a couple seconds to get started. I'm Orlando, your social media influencer with Whitman-Walker Health. If you don't know, well, now you know. And if you don't know, then get your stuff together and find out. So we are talking today about health insurance being very important to have if you're trying to reduce medical costs, especially during COVID-19 pandemic, when people have sought out to access services at a higher rate. But unfortunately, it can be really difficult to navigate health insurance. Many of you may get insurance from your employer, but others might get it from the state or not have it at all. So today we're going to talk to Keith, the manager of public benefits and insurance navigation at Whitman-Walker, where they have worked since 2015. We will cover all things insurance, including expanded eligibility for finance assistance through the American Rescue Plan Act, aka COVID-19 stimulus package. Welcome, Keith. How are you today?
Hey, it's good to see you. It's been a minute.
I know.
I'm doing okay. Doing good.
Good, good. Well, if you guys have any questions outside of what we're talking about related to our subject, please, please, please come on in, write some comments. If you are shy, DM us in private at Whitman-Walker. Did you want to introduce yourself, please?
Sure. So as Orlando said, my name is Keith, and I am currently one of the managers of our insurance navigation or public benefits team here at Whitman-Walker. And my pronouns are they, them, and I'm excited to talk all things health insurance and answer any questions y'all might have. Like Orlando said, if you don't want them answered on the live session, we've got direct messages, or we'll post. I'll let you guys know.
And are you okay with us asking some specific questions?
I am. Do it.
All right. So question number one, we kind of touched already. What is your role at Whitman-Walker Health? How do you help Whitman-Walker and their clients?
Sure. So currently I help oversee an amazing team of folks that we call insurance navigators. Currently they're helping folks remotely during public health emergency, but connecting still with community and patients. We're here to focus on people that have health insurance needs. We help look at options with them or troubleshoot any problems they might have with their insurance, or maybe just their cost of care if they're not insured, or if they're underinsured. And we help of course, our Whitman-Walker patients, but really anyone in the DMV area that needs help. So, we're really mission-driven, trying to promote better access to good quality healthcare and healthcare inequality. So, we're really here to help find the best health insurance for you, take care of your needs, and make the amount that you pay for your healthcare more affordable.
Well, we definitely appreciate that. You guys are working around the clock to make sure people can be insured. That's super important. So we really do appreciate you. Thank you.
Thanks.
Let's see. Question number two. This is a really big question, but maybe in just a general sense. How did the Affordable Care Act change healthcare when it was enacted in 2010?
A huge question, but super. So yeah, I can elaborate a little bit. So the Affordable Care Act has a couple of different names. So some folks might refer to Obamacare. or the marketplace. But, it really dramatically changed health insurance in this country. I'll talk about the two biggest ways. So one, just creating a lot of protections for patients and consumers getting health insurance, and it also just expanded coverage options that just didn't exist prior. So, on the patient protections and consumer protections, some big things that are talked about and super important for folks that we work with are just eliminating the idea of pre-existing condition clauses. So before the Affordable Care Act, a lot of people that had been diagnosed at some point with health problems were barred from enrolling and getting insurance at all. And it also crazy, right? So got rid of that, and also just the creation of lots of anti-discrimination regulations that were hurtful to folks, and also especially folks that we work with. So on the basis of sex or sexual orientation or gender identity, and so that was huge. And then the second piece is really just expanding and making new coverage options for folks. So one big thing is allowing folks to stay on their parents' insurance until they turn 26. Also created a new Medicaid category called for childless adults. So prior to the ACA, you had to be very low income child or parent or disabled or older person. And so that, addition to allow more folks into the Medicaid program was really big. And then lastly, just, creating the insurance marketplace in every single state so that, we as a nation could sell individual and small business health insurance plans. And so those plans are more strictly regulated to make sure that they have quality coverage and that each of them contain, these essential health benefits, of which there are 10, but, kind of the big ones are, emergency care, prescriptions, and mental health, and making sure that all of those plans do cover those things.
Wow, I wish I could have stayed on my parents' insurance till I was 26. Way past that bracket. We're years past that bracket. Been like, can we stay on till we're 40? That's crazy, but I mean, we appreciate that. That's super important. So can you talk a little bit about the open enrollment period, what it is, who can enroll, and when does it end in DC?
Yeah, so it's a great question. Open enrollment normally starts November 1st of every year, but here in DC, you can actually enroll in private coverage, affordable private coverage right now. Basically, just while we're under the public health emergency, DC's made a big effort to allow folks to enroll, in a time when folks really need insurance, and so. The Biden administration also, I think you touched on the COVID-19 stimulus package or American Rescue Plan. So, I mean, that's also just really increased the amount of people eligible for financial assistance and paying for those Obamacare plans or those marketplace plans. We've got some that are as low as $2 now. There's additional savings that just weren't there before COVID. And so we're seeing significantly lower monthly premiums and monthly amounts that folks need to pay for coverage. Even if you've been on unemployment for even just a week, you can look at even lower premiums. So I really encourage those that may have found coverage unaffordable prior to really look again, because the open enrollment period is open right now, and that's not always the case. So definitely want to get folks back in. But I also want to clarify, this term open enrollment can get thrown around a lot in different ways. So, today we're really talking about folks that are getting health coverage or need it through the Affordable Care Act. So if you're getting your insurance through your employer or any public options like Medicaid or Medicare, all this talk about open enrollment really doesn't apply to you. So those folks are covered, so they don't need to really worry about those different enrollment periods.
Perfect. So if you're not insured and you have any questions, please hit us up at Whitman-Walker. That is what Keith and her team do to help you understand what it is, the process, and try to help the best option for you. So don't be shy. If you know someone, with a language barrier or something that just doesn't go out of their way to try, please hit us up. Like that's exactly what they're there for. So, hit us up and we'll see how we can help, right?
Please do. We also, most of us speak Spanish too. But yeah, language, if you need an ASL interpreter or any sort of other language access, we can always do that and arrange that for you.
I'm pretty sure you speak Spanish too, right? We had a live in Spanish, ¿verdad que sí?
Claro que sí, yeah.
Okay, see, Keith speaks Spanish too, y'all. So, all right, so let's see. So, why should our viewers take advantage of the opportunity to get coverage?
Well, I think in reality, no one plans to get sick or hurt. And the truth is, most people need medical care at some point. And this past year has become and sort of shown us how even more critical it is to have access to affordable and quality health care as we are continuing to fight COVID and other things going on. So I think health insurance helps cover those costs and offers other essential health benefits. Outside of just that care, emergency care, prescription coverage, mental health that I mentioned before. It also offers free preventative care. So actually things that don't have to come out of your pocket, that you can just get your checkups or, your preventative care that you need, like vaccines or, screenings or health checkups. So, I know we all know healthcare is expensive, but health insurance is really what protects you from those unexpected and high medical costs. So, we here in DC and the district in general has a super strong commitment to trying to get everyone covered by health insurance. Obviously, that's, a huge goal and a big thing that my team is a part of, but also that DC just offers a lot of generous, eligibility criteria for folks under public insurance. So, we just want to really make sure everyone is aware of their options, and we are just always going to work to find something, that meets your needs.
So, personal question, is this just for people who live in DC or anyone in the DMV area?
Yeah, great question. I think our expertise lies in the DMV area. So, of course, we're often working with folks in DC, but we also do help folks in Maryland as well as Virginia. And so, you may need to go different places or different websites to look at those options, but we definitely are, well-versed in those three areas. And if it's a state we don't really work in, we can help find, close by assistance, someone like us that might be able to help.
That's awesome. That's awesome. So if you're not sure, hit Whitman-Walker up. They can find you where. If we can't do it, we'll find out where you can go. So being that said, where can people sign up?
Sure. Folks can go to dchealthlink.com. You can look at both public options and private options. If you're in Maryland, it's a different website, but marylandhealthconnection.gov. And any Virginia residents would actually go through what we call the federal exchange, which is the more known one, which is healthcare.gov.
Okay, beautiful. Now, who should our viewers contact if they're confused and or need assistance?
Us, please. Our public benefits and insurance navigation team here. We're here to help folks year round. So, whether we're in open enrollment or outside of, the public health emergency, we're still here. We've been around since before the Affordable Care Act. And, I think, since we're remote right now, we've mostly been connecting over the phone. So there is a direct line to us. Also, if you're on the DC HealthLink website, you can connect with us under the Get Help tab. And we're available to speak with anyone and everyone, whether you're a patient or not. Just kind of go through your options and what you might qualify. And please, just give us a call.
So perfect. So if you're not sure about how to get insured and you want to be insured, or you're not sure about getting insured and you have questions on how, where, why, hit us up. Our public benefits team is definitely there, eager and super helpful to try and get everyone insured. Just, you never know. You can't be a superhero. You can't never get sick. And it's not even about really getting sick. I mean, like a therapist, if you're like, you need to talk to someone, if you're lonely, there's a lot of other programs included in your insurance that are super helpful to get your mind right, your physical, mental, and everything right. We really appreciate you, Keith. Thank you for coming in today.
Thank you. I always appreciate talking with you. Thanks for all your...
Of course. Do you have anything else you want to tell our viewers?
Nothing else. I think just just a reminder of how to get us. Send us a DM if you have any questions, or you can call us at 202-745-6151. The number's on the website as well. And we'll look forward to hearing from you or your friends or any family members that you think might need help.
Hey, Bianca, I see you have questions. So DM us at the Whitman-Walker page right below. Go ahead and follow us, DM us, and we will be able, there's a phone number as well that we just posted up. Any kind of questions related that we can get you help or assistance with, definitely we can get you connected to the right person. So let's see what else we have here. Don't forget, everyone, we're still in a pandemic. So if you want to get vaccinated, there are a dozen or so walk-up sites throughout DC where you don't need an appointment. You can just go get your vaccine. If you want to get vaccinated at Whitman-Walker, you can still call 202-207-2480 or email appointments at whitman-walker.org to schedule an appointment. We'll also be registering people at our outreach events that are starting up as we go now. If you've already gotten vaccinated, congratulations. The CDC has given you the okay to relax on some of your mask wearing and return to some pre-pandemic activities. However, it is still understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols to know who actually is verified as vaccinated. If you haven't been vaccinated, please continue to follow the CDC guidelines, wearing your mask, quarantine, social distancing, and it's very important you get your vaccine. Discuss any precautionary measures with those around you. Be mindful of your mask and keep your distance, especially when you know that not everyone around you has been vaccinated. Don't forget to please follow us on Instagram, Facebook, Twitter at Whitman-Walker, and check in our website, www.whitman-walker.org, for the most up-to-date information on services, on COVID-19 resources, and general Whitman-Walker services. Again, that number is 202-797-4439, and follow some of our programs with the Whitman-Walker Health family at Real Talk DC _ No Filter DC, and The Corner DC. Again, we appreciate you all. Don't forget, DM the Whitman-Walker page for any questions, concerns, or just curiosities you might have. Thank you again, Keith. We'll see you soon, I hope.
I hope so too. Have a good one.
Thank you. Have a great weekend or week. It's Monday. I'm on vacation. That's why I'm like forgetful, see? That's why I'm out here at the pool. But anyway, we'll see you guys soon. We appreciate you all. Be safe.